Well, good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. It's Paul Thomas. It's Bill Kearney of Northlake Medical Pharmacies. And Bill, welcome back. How are you today?
Doing great, Paul. A beautiful day out there again. I thought we were over the rain till I washed my car last week and
then it rained.
And then it rained on
I think typical
Monday going home. So, but it's a beautiful day. Summer's and spring's on its way, and of course the allergies are really significant right now. But we have so much to talk about today, so don't tune us out early because there's a lot going on in healthcare, and unfortunately a lot of it is negative stuff. You heard about all the crackdown on opiate prescriptions, and we talked to you about last week and the week before about the new guidelines by the CDC on prescribing opiate drugs and what comes out over the news media yesterday. But the amount of people that have been overdosed on Norco in Sacramento, and 6 deaths dealing with Norco that they think is actually combined with fentanyl, which is a Duragesic, which is a pain patch that's mainly used for cancer. And it's now much more potent than heroin. And people that are getting overdosed and dying from it is significant. And that's what's going to keep happening as we tighten the screws on opiate prescriptions. And the physicians are really being checked on whether or not they're prescribing these medications or not. This is going to continue to happen. And this one, nearly 30 people had been overdosed, and in less than a week in Sacramento after using a tainted form of narcotic painkiller that was sold on the streets. It appears to be laced with fentanyl that's 100 times more potent than heroin. The Sacramento County Division of Public Health reported yesterday the drug has caused at least 28 overdoses and 6 deaths since March 23rd. So as the United States continues to struggle with unprecedented heroin epidemic because it's the most inexpensive form of a narcotic, fentanyl has become a popular and extremely dangerous alternative. The only thing we used fentanyl in the past for were people with chronic pain. It came in patches that lasted for 72 hours, and now people are cutting those patches and taking the active ingredient, it's a gel, out of there and combining it with other opiate narcotics to increase the chance of an overdose or death. So what we've talked about has happened several times with physicians prescribing these medications, and then people getting them. If they can't get them through the legitimate pharmacy market, they get them on the street. And as part of this urgent response to the epidemic of overdose deaths, the CDC, or the Center for Disease Control, issued new recommendations for the prescribing of opiate medications for chronic pain, excluding cancer and palliative or end-of-life care. I told you not to switch the channel here because there was going to be a lot of revelations about new things that were going on. And Paul, I don't know if you remember, but last week we were talking about or the week before, about end-of-life medications that people, yep. June the 6th, people will be able to finally get medications in California that allow them to die with ease.
I do remember that, yeah, quite controversial.
The drug that they talked about on 60 Minutes was secobarbital. It used to be relatively inexpensive. It's on a Schedule II status that's used for sleep deprivation. And when California's Aid in Dying takes effect this June, these patients who decide to end their lives could be faced with a hefty bill for a lethal medication that's over $3,000 for 100 of these. And this is, like I told you last week, from being the most ethical profession and the drug industry when I got into pharmacy to the most unethical, not at the pharmacy level, not at the retail level, but at the manufacturing level. Valiant Pharmaceuticals, it's a company that makes the drug most commonly used, doubled the price last year, 1 month after California passed the legislation. And it's just a pharmaceutical greed that where now a patient needs this medication in order to end their life, and the drug has been tripled in price. It's secabarbital or Seconal. It was developed in the 1930s. It fell out of favor when people died from taking too much or taking it in combination with alcohol. It was never intended as a lethal medication to hasten the death of someone suffering from a terminal disease, but it's now become the drug of choice. As we talked about last week, it works very quickly and gently. After 5 minutes, you go into a sleep, and after 30 minutes, you cease breathing. It's a very gentle passing. But in 2009, the price of a lethal dose of Seconal, 100 capsules, was less than $200. Over the next 6 years, it shot up to over $1,500. And Valiant Pharmaceutical bought Seconal in February and immediately doubled the price to $3,000. Now, this is a generic form of a drug that had been developed by Eli Lilly in the first part of the 50s. Although it had originally developed in the 30s, but it became very popular in the 50s and 60s. Most drug companies justify such hikes as pointing to research costs. But that wasn't the case with this drug. We knew about this drug for the last 100 years almost, or 70 years. So they usually say it's because of R&D, research and development, that there's such a high cost. It's not a complicated thing to make. There's no research being done here. There's no development being done here. This is just unconscionable that a drug company would do something like this. They bought several other drugs at the same time. It bought Seconal, raising some of those prices as much as 500%. The CEO resigned Monday, and amid an accounting controversy. So when you set prices based on a number of factors, the company said in a statement, including the cost of developing or acquiring the drug, the availability of generics, and the benefits of the drug, they tend to get completely out of hand. The most likely explanation for the raising price of Seconal is the lack of generics available. Nobody wanted to make this drug in the last 50 years. Because it wasn't a good drug of choice as a sleeping aid as the newer sleeping medications came out. Now remember, this drug is 100 capsules. You take 100 capsules, open them up, put them in a drinkable solution, and you take the whole 100 capsules. So if you were just taking one pill, it wouldn't be that costly, but you're having to take the whole thing, or that's the way it is in the state of Oregon. And it went off patent in the early 90s, and there were some generics for a while, but the demand was so short that it wasn't cost effective to make it. So that meant when the current company bought it, they didn't have any generic competition simply because the market got so small, and then it left. So in situations like that, a company can acquire it and raise the price, which is exactly what happened. Here's a company that said, well, we can raise the price and keep the market and make a lot of money with it, or we can walk away and the product goes away. So they decided they would stay and just keep raising the price. So they were, when somebody's diagnosed with a terminal disease now, you're going to, a company is going to make money off your death. And you're literally at that point taking the money from children and from people that need it, when you're going to die. So under the California Aid in Dying law, it's optional for health insurance companies to cover the cost of the practice. Most private insurance companies plan to do so. But for patients who aren't convinced there's a cheaper alternative, there's a 3-drug cocktail that can be mixed by a compounding pharmacy for about $400. Now, we're a compounding pharmacy. We intend to check into that. Again, as we talked about last week, this is an issue about the oath we take as pharmacists and physicians. We're used to giving people drugs with an interest in making them better or keeping them from getting sick. We're not taking an oath, or haven't been taking an oath, to end people's life. So it's going to be an issue as far as healthcare goes. There will be pharmacists that won't fill these prescriptions, as we have pharmacists that are allowed not to do birth control pills at this point because it goes against their religion. In a situation like this, I'm not sure how it's going to be controlled. We will certainly keep you up to date on what's going on and how this unethical Valiant Pharmaceutical company has continued to jeopardize the financial ability of people to pay for this drug. And along that same line, this morning I had a message on my internet saying there was another drug that people in America pay 300% more for, this prostate cancer drug, than most of the rest of the world. It's $129,000 a year. It's for prostate cancer. It's called Xanti, Xanti. You need to know how the marketing takes place for pharmaceuticals when a drug is on the market, when you can go to Canada or Mexico and buy the drug for 10% of what you pay for it in America or Ireland or European countries. They market it by the financial status of the people in the community. So when a drug comes out in America, because it's one of the wealthiest countries in the world, the amount and the R&D is usually done in Europe or done in America. The price is substantiated and determined by what the people can afford to pay for it. Then when people start getting it in Canada or Mexico or Ireland or London or wherever, it's a lot less expensive. And the reason is they know the drug won't market well if it's to the so expensive that the people can't afford it. So we pay for the R&D, we pay for all the development, we pay for all the research. We charge a higher price because we think either the customer will pay for it or the insurance company will pay for it. And then we end up having the highest price in the country for our medication. So, and you can see that the ethics of these companies that have the drug available and manufacture the drug, and granted it takes $1 billion to bring a drug to market, but the patient isn't taken into consideration. Just like hepatitis C, we've talked about $84,000 twice to cure hepatitis C with Harvoni, $168,000. The people that dispense it, such as a pharmacy, are lucky to make $1,000 out of $168,000 that this is going to cost. So somehow these things have to change in pharmaceuticals, or we're not going to be able to survive the conditions, and it's going to get worse. The big chains like Walgreens keep getting bigger and eliminate the independents who are trying to be competitive. Walgreens, which is Walgreens Boots Alliance because it has bought a company in Europe, they've just bought their own pharmacy benefit manager, which is OptumRx. And now they don't have to worry about filling a PBM taking a lot of the money when they fill a prescription. They control the pharmacy benefit manager, so automatically that puts about 67 million new patients into the Walgreens source, and they eliminate the choice because they make it a preferred network, so we're not able to join in, and some of our listeners have to go to Walgreens already. I started my career at Walgreens in Chicago. Mr. Walgreen was my district manager, and then I followed him after I came back from Korea and Vietnam for and I went to Denver and then to Utah and then to California, managing stores. So I learned a lot from that company, but at that time the company was all for the patient. Now they appear to be for the patient, but they're trying to eliminate the competition, as all major chains are trying to do by getting bigger and eliminate the competition. It's a sad state of affairs when you look at the healthcare situation in the country today, and I briefly went over the protocol that my wife has to go through in order to have a knee replacement because she's on Medicare. The protocol steps have nothing to do with making her knee better. They only cause her a lot more pain. So when situations like that happen, then we know that it's a matter of government protocol. There's no way we can avoid it. We have to go through the painful steps in order to deal with it. And in order to have a knee replaced, and you go under more pain in order to get that to ultimately replace a knee. We get hurt a lot, and Paul, we're guys, and a lot of time we just cut ourselves or hurt ourselves or have a heart attack, and we don't think it's important.
Sure.
Tough it out. Believe me, I mean, there are people that literally do that. Mm-hmm. So I went online because it's very confusing for people, and there's 5 medical conditions that you need to treat immediately, and that is you've got to get somebody to a healthcare facility. The number one thing is a stroke, and for every 20 minutes that goes by after a patient suffers, there's millions of 2 million brain cells die when there's a clot there without medical intervention. So, and that can mean consequences such as permanent paralysis or the loss of the ability to speak. There's a drug called IPA or TPA, which has to be administered within 3 hours or 4.5 hours of in some patients in order to do any good. After that, the side effects such as bleeding in the brain outweigh the benefits. So if you deny a family member the experience and symptoms of a stroke and sudden onset of slurred speech or loss of balance or weakness or shortness of breath, get them immediately. You have 3 hours to get somebody in to get that clot-busting drug and to keep them from enduring a permanent effect of that stroke. A deep cut, a puncture wound, or an animal bite, of course, a tetanus injection can cause painful contractions. Infection can cause painful contractions of the jaw, neck, abdominal, chest muscles, and those kind of things. Tetanus bacteria can survive in dirt and manure and can enter the body through breaks in the skin. Everyone should have a tetanus booster like every 10 years. We do that. The combination now is tetanus, diphtheria, and pertussis. So it's whooping cough and tetanus and diphtheria. And if you don't know that you've had it in the last 10 years, get it. Even if you had it 5 years ago and you don't remember or you don't have a record of it, get that tetanus shot anyway. If you've had fewer than 3 tetanus vaccinations over your lifetime and you have a deep cut or a puncture wound from anything that may be dirty, including animal bites or a stick of a shot of tetanus immune globulin along with the standard booster, will prevent the infection if given within 72 hours. So I just had a person that came in Monday and had put a rusty nail in his finger and didn't want to go through the emergency room, didn't have time to make an appointment with the doctor, and came in and got a tetanus shot and paid for it, didn't even throw it through his insurance. And he got it into a system within the 72 hours and did very well. Have you ever known, Paul, anybody that had Bell's palsy?
Well, there was a time when somebody I knew thought that they had Bell's palsy. Let me take that back. Probably has Bell's palsy, but thought that they had Lou Gehrig's disease instead. But we think that now maybe it was just a minor case of Bell's palsy. It had to do with speech.
Yeah, that can happen. It could just come on. You can wake up in the morning and it's there. I have a sister that got shingles, and eventually she got Bell's palsy and thought it would go away, and it needs to be treated immediately. Most people eventually recover, but some may experience long-term disfigurement. Taking oral steroids within 72 hours helps sometimes because it's an anti-inflammatory-like thing. Again, it's been 5 years for my sister. She has, looks like she's had a mini stroke. She's younger than I am, and she can't get rid of the herpes virus, even though she's taken antivirals to take the shot for it. So it's something that you need to be aware of when you, excuse me, when you think you've had it or it's Bell's palsy. Then go to an emergency room or a physician and have them diagnose what it is and treat it right away. Sudden deafness, and I never thought about this before, but it's something that you have about a 72-hour window. It ultimately occurs in just one ear, and then can be accompanied by a ringing or sometimes a vertigo. Some research shows that the treatment with steroids or vasodilators will help. You have about 3 days to address it when it's sudden deafness. So generally, treatment can be beneficial when started within the first week or two, but not helpful after 30 days. I just had a patient the other day call me, and she had tinnitus, which is a ringing in the ears. And it only started when she was taking a certain medication, which happened to be a medication that was an antidepressant, and it's used for other things also. And so I'd never heard of it. I did some research, and about 6% of the people that took this medication got tinnitus. And the ironic thing about it was it didn't always go away when you quit taking the medication. So it's important when something like that happens to, in this individual's case, they lessened the dose by 50%. And it still did not make any difference. And when I went online, I found that there was a lot of people that took this medication that it never went away, no matter how long they waited. And tinnitus, although it's not deafening, can be irritating because it's a ringing in the ear that never goes away. And it can be severe and it can be very minor. But I'm one of these guys, Paul, if all of a sudden the smoke detector the battery runs out, and they start that just beep, beep. I mean, I go nuts. I couldn't imagine that being in my ear. I have to rip that thing down, throw it away, or get a new battery in there.
It's pretty funny because I think my wife is similar to you, where it's like something like that I can tune out pretty easily, especially if I'm like doing something, watching a show or actively involved in something. That can go away real quick.
Yeah. Well, I have a controller on my gas fireplace that all you have to do when it starts beeping is just go back and get the flame started again, and then just put it on automatic, and it goes away. But I could hear that, I can hear that 3 rooms away, and it's not a loud sound at all. Yeah. But those kind of things are what tinnitus is like, and so when you get something like that, it's important to treat it as soon as you can. We're going to take a break, and we're going to talk about something that can make you pretty miserable, social media habits that really are affecting your lifestyle. Did you know that according to the American Heart Association, heart disease is the leading cause of death among men and women in the United States? Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies. The good news about the heart is that a healthy lifestyle can prevent the vast majority from the disease. There are risk factors that you can't change, such as being male, being older, and a family history of heart disease. But other risk factors that you can change. Smoking. Do you know that 30% of all the deaths from heart disease are directly related to smoking? High cholesterol cholesterol. Limit your fat intake and limit intake of cholesterol. Increase your intake of vegetables and fruits. Exercise routinely and drink 32 to 64 ounces of water daily. When these things are done in combination, they can drastically reduce your chance of developing heart disease. While these procedures are very important for people with risk factors, they're even more important if you've had a heart attack. North Lake Medical Pharmacy with 2 locations for you, and now free delivery to Lakeport, Nice, Upper Lake, Lucerne, and now Kelseyville, the Rivieras, and Buckingham.
You, my friend, have connections in the government. Yes, you. USA.gov, the official source for government information on thousands of topics. And like any good connection, there's no telling where it can take you. Why, one day you're getting student loan information. Next thing you know, you need job hunting tips. Today's road construction info could have you searching for telecommuting ideas tomorrow. The more you use USA.gov, the more uses you'll find for it. Passport applications, for example. They've been known to lead to a sudden interest in travel advisories. Our new mobile apps will even update you on the go. So whether you have information to get or ideas to give your government, check out USA.gov. Who knows? Lottery results today could lead to retirement planning tomorrow. USA.gov. With the right connections, there's no telling where you can go.
Let's face it, these hard times are a little harder for some of us, but it doesn't mean you need to break the law. In California, it's the law that you must have auto insurance, and you may qualify to get it for around $400 a year through the California Low-Cost Auto Insurance Program. You must be a good driver, at least 19 years old, continuously licensed to drive for 3 years with a vehicle valued at $20,000 or less, and meet the income eligibility requirements. Call 866-60-AUTO-1.
Captain Eric Lawrence was training Afghan soldiers when his truck was hit by an IED.
I was on the way from Kandahar to Kalat, hit an IED that just took the truck and threw it up in the air and slammed it on the ground. I knew at first that I got hurt pretty bad because I couldn't move my legs. I sat home alone for months. I didn't want that anymore. I wanted to go back to work. I was hesitant at first, because I didn't work for a good year. I want to be a productive person. I don't want to be a drain on society. I want to be a positive thing in society. PVA helped me write my resume, got me a job interview. I got the job.
Helping veterans like Eric is what we've done for over 65 years. Paralyzed Veterans of America, paving access for veterans' employment through Operation PAVE. For more information, visit pva.org. A public service message from Paralyzed Veterans of America.
All right, we're back.
All right, Paul, do you use social media at all?
I do for work.
All right.
It's a big part of what we do here at the radio station. But personally, I have a Facebook account, but I don't use it.
I am on Facebook just to keep track of my kids, but if you're always telling your kids or grandkids to get off the phone, but you might want to listen to what they're saying, because a new study links depression and social media usage, showing people who browse social media the most likely to be depressed. And if you look at these websites, other than people that say hello sunshine and most of it is a negative thing. Mm-hmm. And a survey of researchers found that people who used the social media were significantly more likely to be depressed. People who used it the least, on the other hand, wanted and were the less likely to be depressed. So though the researchers showed a clear link, the authors of the study didn't recommend logging out of social media completely. So how much is too much? A few signs that it might be time to close out your snapshot and log off Instagram. A good example of that is Easter, which was last Sunday. I had 16 people at my house. I had my kids, their kids, their kids' kids, and boyfriends, and every one of them was on their phone. I mean, I had every plug-in available for them to charge up their iPhones. if your Facebook feed is all political rants and depressing news from friends or family, and it might be time to tune out with the constant exposure to negative news. And I don't know that that's any different than watching the 6 o'clock news at night on the network TV stations. Reading about your great aunt's bad knee or an accident that just happened and somebody just passed away. And then if you're feeling more than just a little jealous because you're not in there watching, then maybe you should go back on the internet or back on your Facebook and look at it. I'm watching a TV show with my wife last night, and I'm on the Warriors game with my iPad watching. I don't know that that's any different, except it's entertaining. But and then when you're scrolling through Instagram and see your friend has a new cool outfit or hanging out with a new boyfriend, and whoever the other people are on the other end, especially in high school and college and even junior high, that other person gets a little bit jealous, and next thing you know, one of the people in my family was threatened with a text the other day in school that this person was going to cause harm to him, and of course law enforcement was involved and everybody else, but it came off the media. So if you feel particularly alone sometimes and you need to get on Facebook or Twitter or Snapchat, social media is meant to keep us connected, but all the digital togetherness can take a toll. The same can go for seeing others have fun while you're not having fun. And people are with the white picket fence and show people that the life's perfect, which it makes it look perfect, but it isn't. Instead of chatting with your friend on Twitter, why don't you go out with that person and have an ice cream or go to the drive-in or go to the movies or do something to actually make facial contact, because we're so used to not having to confront somebody to say to them something negative. It's easier not to face them. So if you take a tip from this study, if more social media use is linked to more depression and you're feeling depressed, track how much you've been checking your accounts. If you think it's a lot, maybe it is. Your depression could be connected to all those toxic feelings of jealousy and inadequacy, and that social media can raise it. I mean, many times it shows these successful friends of yours that may or not be the happiest people in the world projecting to you that their life is better than your life. And social media, instead of holding on to all those feelings, try deleting one of those or more of your social media apps from your phone. I don't use my phone for social media, but I do look at Facebook on my iPad, and many of those kinds of friends I have deleted. I'm sure many of them wonder why. You might be surprised at how much little information you actually get from this. If you're also feeling bad about things you're reading online, and you're overwhelmed by the tragedy in the news, just turn the thing off and go outside, go for a walk. During Easter dinner, all the cell phones were turned off. We did the same thing at Thanksgiving and Christmas. You would have thought we'd have cut off an arm, because
True. It's absolutely true.
If people couldn't find their phones, they were all panicky. I had my best thing was I had a thing that kept my internet kept from bouncing off, and one of my granddaughter's husband works in the computer industry and the phone industry, and he brought a little booster down, and I wasn't getting kicked off my internet anymore, and I felt like I'd just bought a new
satellite internet.
No.
Mediacom?
I have Mediacom, and I kept getting bumped off and bumped off and bumped off, and he said, "Well, the signal isn't great enough." So
That's strange.
he put a little booster in there, and it doesn't happen anymore.
So just a little thing like this in between
Yeah.
the line and the modem.
Yeah.
I've seen those.
we've talked about statins a lot, and we've talked about the negative, and we've talked about the positive, and sometimes the negative outweighs the positive. And if you remember back in 2013, the guidelines changed with statins, saying more people were to take statins than we thought before. If they had a risk that was 10 to 20% higher than their cardiovascular risk, they should be taking it. Then they came up with statins prescribed for people with greater than a 7.5% or greater risk of a heart attack or stroke over a 10-year period, including many with no cardiovascular issues. So that meant they didn't have a tendency to have a heart attack or a stroke, and they had no history of that. They have stirred a lot of controversy over the potential of dispensing more and more statins, and critics argued that the cardiovascular risks were overestimated, that healthy adults would be overtreated, and that more people would be at increased risk for negative side effects such as memory loss and type 2 diabetes and myalgia. Proponents pointed to strong evidence that expanding statin use would reduce the risk of a heart attack and stroke. By the way, our number is 263-5252. I forgot to remind you of that. 263-5252 if you have any questions that you would like to ask us. This article that was found in the Journal of American Medical Association was in 2013, and it was likely to be reasonable and cost-effective, and there's no question now as to whether to offer treatment with statins for patients for primary prevention. The guidelines might even not go far enough, and now they're saying while the greater than 7.5% risk threshold was determined to be cost-effective, they noted that an even lower threshold of greater than 3% would be optimal and would avert an additional 160,000 cardiovascular disease events, meaning a stroke or a heart attack. So those findings offer a lot of guidance for patients that are at an intermediate risk. And I don't know how many times I've talked. I just talked to one of my relatives out of state last night about the medications that were being prescribed for her. She'll be 80 years old, and she says every time she goes to the doctor, they prescribe another medication, and yet, both her and her husband are diabetics, and they continue to think that they watch their diabetes, but although they watch their sugar, they don't watch the carbohydrates they eat that turn into sugar. So the most challenging group in clinical practice to decide initiate therapy is they found that cardiovascular events had occurred more frequently in people who would have been eligible for statin treatments under the specifically 6.3% of patients who have been eligible for statin treatment. In addition, the cost-effectiveness of statin therapy has lowered the risk threshold for a lot of people. Statins have gone from just the opposite of these brand-name drugs of between $1,000 and $2,000 a year when they first came out to less than $100 a year in the generic. So what we're saying here is there's a lot more people that probably should be taking statins than are taking statins, and it shouldn't be cost of the drug shouldn't be a big problem. Side effects of the drug, which we talked about, could be memory loss, some of the muscle pain that can occur, and the tendency to perhaps cause some diabetes. So one limitation is that the population that they studied was predominantly white. So the results may not be general to be able to generalize with complete ethnic groups, but these don't dictate that eligible individuals should automatically be issued a prescription. But they need to have their physician look at it and see whether or not they think they should be eligible. Now, one of the problems we have in Lake County is we have fewer and fewer physicians. So you may not be seeing the same physician every time, and they may not look at it. And then if you go to another area, say a Santa Rosa or a Clear Lake, and you see another physician, they may not be aware what the primary care physician is already giving you. And so unless there's communication, it's going to be very difficult to find out. The irony of this is, with this medication, you feel like, well, even if I'm a risk, I'm not a risk as long as I'm taking the statin. Well, unfortunately, because of that, we don't change our lifestyle. We have people that weigh 300 pounds that are taking statins and still eating like they were 120 pounds. And only because they're taking a medication that takes care of it. That person probably also is a diabetic, and they're taking medications to produce more insulin or let sugar be released at a slower rate than it normally is, and so they think they don't have to change their lifestyle. As we get into more progressive health care, and who knows what's going to happen in this next election, but things are going to change as far as health care goes. It has to change. And instead of getting less for more, you should be getting more for less. And that isn't the case. In statin therapy, that is the case. The generic drug is less expensive. But again, if you're only taking the medication because you don't want to change your lifestyle, then it's kind of a moot point, because changing your lifestyle is what's going to save your life. The medication is only going to temporarily keep it from happening, and then eventually you're going to have to deal with it, and then you're going to have a problem on what am I going to do. Paul, we're going to go back to that mail thing that we have when we get a condition where we need to see somebody immediately. Mm-hmm. Being injured sucks, and simply when fitness is a part of your identity, it can make your whole life thrown off track. If you're used to, like I am, swimming every day, and all of a sudden your pool heater breaks and you can't swim every day, and a lot of people and you will get to this point eventually, you have to work out every day. You'll start working out one of these days and surprise me, and then you're going to miss it if you don't do it. And you start getting depressed because you can't do it, especially if you have an injury. But a lot of people think that their world is over if they've got an injury that maybe this leg has put me out of commission for going on 4 months. And it's perfectly fine to be sad and angry and disappointed for a while. It's important to remember there's more to you than your sport or fitness passion. But even professional athletes who do this for a living have other interests and hobbies. I can remember reading yesterday about Bill Walton, and he had ruptured a disc in his back, and he was working for ESPN. This was just 5-6 years ago, and he contemplated suicide.
Wow. Because
he thought he would never not get hired back.
Wow.
And so you kind of get stuck in this denial phase that you're not going to get better. And it's tempting to stay in that self-denial about the severity of the injury. Unfortunately, there's only two ways to escape that. Either you train through the injury and you make it a lot worse, or you go get professional help, and it will be a much more pleasant experience. Go to physical therapy. Work on an exercise program that gradually brings you up to try to make yourself. Right now, if I tried to make myself do a marathon or something like that with my broken femur, I don't know that I would recover. So you have to face the facts that maybe you have a new normal. Me with 4 back surgeries and a shoulder surgery and an ankle surgery and a femur surgery. I have to realize my life has changed. It's tough when you need to move old goals to the back burner and start finding new ones. And comparison is the thief of joy. So try not to view your current situation through the lens of who you used to be. I just talked to a cousin of mine last night. He's in his 50s. He's had blood clots in his legs. He was a handsome, strapping young man, and he is all bent over now. He's in his he can't work, and he was a contractor. He's developed a really good attitude about it and is trying to accept the fact. But when you're that age and you no longer can support your family, his wife has an excellent job, it really takes its toll on you emotionally. So changing the facts that you can't do, and I've had to do that, things that I could do around the house, sometimes I can't do anymore. I have bad neuropathy in my hands, and half the times I get a soft drink and I take it to my assistant manager and said, can you open this bottle because I can't twist the cap. So kind of plot your comeback. Work with your doctor or physical therapist to define a realistic timeline for when you can expect to be fully recovered, if you can. And I'm doing that with my physical therapist, Lim Martin down at Quail Run Physical Therapy. I'm not going to be the person I used to be with all my injuries. And you can either get negative about it and say, oh, me, or you can learn to do what you can. I'd like to learn to play golf. I was going to have a golf instructor that could teach people that had back injuries on how to golf, and he was out at Hidden Valley. He's no longer there, and I don't know if I ever have the time to play golf, but I still have that as a goal. So sign up for a plan, take a hike, register for a competition that's not I went into the dentist the other day, and my dental technician was cleaning my teeth, was telling me about a marathon she just ran. It was only 3 miles, but although she's a marathon runner, her sister wasn't, and her sister ran with her, fell, broke her elbow, and still was able to, and she wanted to continue on and finish the race, and she did. And you kind of need to treat the process and trust the process for the road to recovery. It can be very difficult, and I think as you age, it even becomes more difficult because you're wanting to get out there as soon as you can. You don't want, if you're highly independent the way I am, you have a tendency to rush things with as many injuries as I have. I've learned that that's not a very effective way to go forward. Going out too hard too soon will only hurt you, and physical therapists will help keep you on track and see that you make it through. So there's an awful lot to deal with when you have injuries, and I think males and aggressive females that are in the marketplace now are really maybe having a difficult time of dealing with this. And it can change your life. You can't let it take charge of who you are and what you are, or you're going to have a long time to heal and recover. So think about those things and get help where you can. It will be much easier for you to progress in the future. We have just a few minutes left. I wanted to talk to you just briefly about drugs that can make you dizzy, because we have a lot of people that get dizzy, and we tell them at the time to take it easy, and we find out what kind of medications they're taking. Antidepressants, for example, can make you dizzy for anxiety. Anticonvulsants, such as gabapentin, Depakote, those kind of things can make you dizzy. Those situations eventually go away for 3 to 5 days. They may be there and then they disappear. Blood pressure drugs to treat you, such as ACE inhibitors like lisinopril. Those drugs open up the blood vessels and go into your heart, so the heart doesn't have to work so hard. But at the same time, it opens up the blood vessels in your brain. So when you go to get up quickly, the blood drops down to your toes. Again, most people get over that and it goes away. If it doesn't, we need to get you a different kind of medication. There are muscle relaxants such as Soma, Carisoprodol, Flexeril that can make you dizzy from just the sedative effect of it. Of course, pain pills that we've been talking about, the opiates, because they affect your central nervous system. And that's why there's an addictive problem with these. There are people that actually like that feeling of not being in control. And so they keep taking them, not for pain, but because they're addicted. Sleeping pills, the same kind of thing. Even antihistamines like Benadryl or things for car sickness, like Dramamine, can make you drowsy and feel like you're, and over-the-counter sleeping pills can make you dizzy. And the last one we think about is nitroglycerin. Many people don't take nitroglycerin like we used to because we have so much better drugs. But if you're having a tightening in your chest, and we call that angina, and it is to the point where the heart is trying to pump the blood through faster than the blood vessel can handle it, and then that blood backs up into your chest through those arteries and veins that are smaller, that's why you get the pain. When you take nitroglycerin, that opens up all those blood vessels around the heart and lets them relax and lets the heart pump the blood through, and then those blood vessels can relax and open up and get more even blood flow, and the angina disappears. That's not a good symptom. I mean, if you're taking nitroglycerin, you have a major problem that you can't take nitro under your tongue for the rest of your life unless you have a chronic condition that doesn't allow surgery to take place, and then you have to kind of live with it. But that's very, very rare with angioplasty and heart valve replacement and those kind of things that are going on today. We can do a lot more than we could in the past. We want to remind you we're still giving vaccinations. Flu shots are over, but we're doing Zostavax and tetanus and diphtheria and pertussis and we even shingles. We had a person come in for chickenpox yesterday and thought that was a little unusual because chickenpox, usually you get a shot when you're very young and then you get a second shot in 28 days after that. If you haven't had a chickenpox shot, then you need to get one. And usually by the time you're 13 years old, you've had your chickenpox shot. And it's a very similar virus to the shingles virus, and we give Zostavax for that. So remember, we're a source for vaccines. We also deliver to you in Lakeport, Upper Lake, Nice, Lucerne, and Kelseyville, Buckingham, and the Riviera. So I'd like to remind you we're North Lake Medical Pharmacy with 2 locations for you. At 5136 Hill Road East, across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno, Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday at 10 a.m. for Health Talk on AM 1270 at 96.5 FM KXBX, and now online at kxbx.com. Be sure to visit the Health Talk page where you can listen to shows going all the way back to October on the Health Talk podcast. That's kxbx.com.